2. Welcome to Adulting 101, Finding Your Path with HCU and MSUD, a joint collaboration between HCU Network America and the MSUD Family Support Group. Good evening, I'm Denise Kolovosky, Executive Director of the MSUD Family Support Group, and I'm joined tonight by Danae Barke, the Executive Director for HCU Network America. We are both so very excited to share this evening with you as we come together in the rare disease community, because we know that we are stronger together. A special thank you to our generous sponsors who make this event possible, including Cambrook, Nexus, Nutricia, and VitaFlow. Tonight, you'll have an opportunity to hear our speaker, but also to put in the chat group any kind of questions that you have about growing up and adulting. We're here to answer your questions, and we're very excited to have you here tonight. And now I'll turn things over to Danae. Danae?
Thank you, Denise. I'm so glad to be here tonight on behalf of HCU Network America. One of the most important lessons we've learned is that our communities are stronger when we work together. And although HCU and MSUD are different conditions, our families face many of the same challenges. And by collaborating, we can share resources, knowledge, and encouragement that benefits both groups. I believe that I'm going to share how tonight will unfold. So first, we will hear from Jess Gold, who will provide a featured talk on transitioning to adulthood with a rare metabolic condition. And then you'll hear from young adults, panelists from both the HCU and MSUD communities who will share their lived experiences and advice. Finally, we'll open it up for questions, so please use the Q&A box throughout the session to drop in your thoughts. Some of the topics that we'll be covering include self-management, navigating school and work, healthcare and appointments, social life and relationships, independent living, and future planning.
So we're thrilled to begin tonight's program with our featured speaker. Some of you may recognize and know her to our different communities. She's been a friend and advocate for many years. Dr. Jessica Gold is a board-certified medical geneticist with dual training in pediatrics and internal medicine. She completed her residency at the University of Chicago and a fellowship in clinical and biochemical genetics at the Children's Hospital of Philadelphia. She now serves as an assistant professor of pediatrics at Normal Health and Cohen Children's Medical Center, where she also directs newborn screening efforts. Dr. Gold's research and clinical work focus on improving healthcare and transition and reproductive care for both adolescents and adults with inherited metabolic disorders. She's been recognized as a National Academy of Medicine scholar in diagnostic excellence and is leading impactful work on genomic testing in adults with intellectual and developmental disabilities. We are so very grateful that she could join us tonight to speak on transitioning to adulthood with a rare metabolic disorder. Please join me in welcoming Dr. Jessica Gold.
I'm so excited to be here. This is my favorite topic. And I wanted to just thank everyone for having me and for everyone who's here for wanting to talk about really the importance of preparing for adulthood and not being an adult with a rare disease, because it's an exciting time and it's a scary time, and hopefully that we can get everyone to feel confident about this transition. I have some slides that I will share. Okay. And these slides kind of just talk about a lot of the basics of healthcare transition, why we need to do it, and some of the aspects that make healthcare transition a little bit more challenging to be doing with a rare disease. Why we need to talk about transition and why this is really a newer topic in the rare disease space is because we know that metabolic disorders have improved life expectancy, especially over the last 20 years with the expansion of newborn screening. So now that we're detecting, over 40 conditions on newborn screening, we really are getting treatment started early, and a lot of patients are beginning to make that transition from adolescence to adulthood. So since over the last 20 years, 90% of youth with special healthcare needs are reaching adulthood. And when we look at the data, over 50% of individuals with metabolic disorders are adults in general. So this is no longer just a pediatric condition. For the most part, this is a lifelong condition and people are reaching adulthood. This data is from a recent study across adult centers in Europe and Australia, New Zealand, showing that these centers are continuing to grow. And that's what we see in the States, although we don't have a dedicated program for adults in many centers. These populations, I mean, in New Zealand, they're seeing 100% growth. In France, they're seeing 170% growth. These populations are exploding. We know that as people are becoming adults, they have new medical questions that we haven't answered before. What about some people are getting prescribed things like testosterone supplementation and new medications as they become adults? Some people are wondering how their new life stages are going to change how their medication works and how their diet works. And then as people are becoming adults, there are new screenings and new standards for preventative medical care, things like colonoscopies. And so how are you as a person who can't fast supposed to prepare for your colonoscopy? And these are questions that are challenging to ask, they're challenging to answer. And for a lot of metabolic patients and metabolic centers, you might be the first person asking these questions, which makes it even harder. We don't have a base of evidence to use to answer these questions. We also know that there are a lot of non-medical concerns with becoming adults. So this is a survey from 2021 done in European centers, and 50% of these respondents were adult patients. And as you can see, they had concerns that were really outside of just medical self-management. What is education like? What I need help with my residence. I need help with vocational or employment programs. And I need help with some of the skills to develop my ability to live independently. And we need a system that's going to address both the medical needs and the social needs. And that's what healthcare transition is. And that's why we have started to talk about it a lot. By definition, healthcare transition is the planned purposeful movement from child to adult-centered care. So pediatric care tends to be very family-oriented, where the caregivers and the child are maybe making decisions together or talking about things together. Adult-centered care tends to be very individual-oriented. So really the expectation is on the adults to be managing their medical care. But it also involves more than just medical care. It's how you gain skills for living at home. It's how you gain skills, how you gain your needed support for education, and how you are interacting with your community. So today we're going to think about how it changes if you have a rare disease, if you've complicated medical management, or if you have challenges with making decisions. Why we think healthcare transition is important. We know that people that do not receive healthcare transition aren't prepared for the future. And what we see with that is that they have high unemployment, high dropout rates from both high school and secondary education, dependency on income supports like SSI through the government and Medicaid, and they have limited ability to enter a day program. And so we're going to discuss how education changes and how after 22, there's not a lot of, there's really limited resources in the community. And so day programs are one of those resources, but if you're not prepared, you're not necessarily going to get placement. Despite the emphasis on healthcare transition over the last 20 years across the board for pediatric patients with childhood onset conditions, we still find that most youth are ill-prepared for this change. And that's partly because healthcare providers consistently show that they lack a systemic way to provide the support needed for transition care. And this is true for metabolic providers when we've surveyed them, and it's true for our pediatric providers as well. Metabolic providers, I think, are the ideal source to be giving us transition information, just because they know you, they know your condition in a way that your pediatrician may or may not. This is an example timeline of what transition care looks like and kind of when it should take place. So really, transition care should be introduced around age 12. And the reason for that is because at age 13, it's time to set up a special needs trust. What this means is that This is a way to save money, or if you get a gift of money, put it away in a place that won't affect your eligibility for Medicaid or SSI when you turn 18. So when you're looking for determination for those supports, they look back 5 years. So you need to be prepared already by age 13 to make sure that you're not removing your eligibility for those programs. Age 14 to 16 is really when kind of transition planning should start in earnest. So kind of making sure that you're talking about what's going to happen after high school, what type of supports you might need for entering college or other post-secondary education plans. And then beginning this pathway of medical self-management, what skills you would need for that. At age 18, you're aging out of a lot of the pediatric programs, so aging out of Medicaid, aging out of SSI, and it's time to reapply for these programs. So at 18 is the application for income supports, at 19 is the application for Medicaid, and then at 22 is when you can graduate, when the last date that you can graduate from high school. 26 is the kind of the last big age. If you're on your parents' private insurance, you can stay until age 26. And so after that, it's kind of that is like really the line where a lot of these supports need to be in place because you're going to lose insurance. So one of the main skills in transition care is medical self-management. These skills are not intuitive. They must be taught and practiced. They're hard to do and they require stepwise preparation. The skills that you're going to need to do for medical self-management should be developmentally appropriate. And this is really what the idea is behind transition care. It's not just giving people a list of things they should do, but really looking to you as an individual and saying, what skills can you do? What skills will you need help with? What skills will you be able to do with help in the future? Around age 14, adolescents should start meeting with their physician alone. And for the most part, these discussions will be entirely confidential, unless a patient expresses self-harm or suicidal ideation or something that they may be a danger to themselves or others. And transition readiness should be assessed at every visit. Your provider might use a checklist or might have a discussion with you about what skills you want to learn. When I see patients who are about 14, 15, 16, I ask them what's the first thing they want to do or what's their next goal. And I let the patient direct what plan they want to make for their next visit. But we always set a goal to learn a new skill between visits. When we've looked at what medical self-management skills are important for transition readiness, we come up with a few categories. The first one is managing medications. So things like, do you know where to fill your prescription? Do you know how to get a new prescription? And can you take your medications on your own without needing to be reminded? The second category is appointment keeping. So scheduling an appointment, arranging a ride to the appointment, and knowing who and when to call for an emergency. The third main category is tracking health issues. So can you complete a medical history form? Do you prepare for an appointment? How do you make a list of questions for the doctor? Do you have plans for what you're going to talk about your appointments? And then the last category is talking with providers, which is, are you able to attend your appointment and talk to your doctor by yourself? Management daily activities are kind of more broad topics that we do address when we talk about transition readiness, but kind of just are necessary across the board. So do you cook for yourself? Do you need help cooking? Do you need help cleaning? Are you able to manage your finances? And do you do your grocery shopping? Another big part of medical self-management skills and healthcare transition is putting together a portable healthcare summary. This is more than just an emergency room letter. This is a summary that asks about whether you have allergies, whether you have durable medical equipment that you need to get. Let's talk about what your formula was and what diet regimen you were on. And not only that, but where do you get your formula and how you get your refills of your formula. Just kind of a really overview of your whole medical care that could be given to other providers if you're going to see a new primary care provider or a new adult cardiologist. Other things to be aware of there are other things outside of medical self-management that you need to be aware of for that transition to adulthood. So among that is the income supports. There are two main income supports in this country: supplemental security income and Social Security disability income. The difference is whether it's kind of how you got paid, how the system was paid in. Technically, if you were employed at some point, you're eligible for SSDI instead of SSI. If you're just kind of starting with income support when you turn 18, you're probably most likely to get SSI. This application needs to be put in at age 18. And the people that should apply are people that received income supports in childhood, or people with disabilities who did not receive childhood SSI because of their family income levels. So this might be something that you're eligible for at age 18 that you may not have been eligible before then. So what SSDI, the eligibility is a little bit different. But if your parents become disability or retirement, then you can move into that program as well. So what happens after age 18? If you were receiving SSI or SSDI in childhood, you're not automatically guaranteed to get it in adulthood. And so it goes through a review called redetermination at age 18. There are different definitions of disability for children and adults, so these benefits are not guaranteed. And so this is why the application process needs to be done for everyone at age 18. It is worth applying if you are over 18 and you didn't get it as a kid, because you may be eligible now that you're an adult, and the income levels that they're taking into account are different. It is worth to apply. You are hoping to apply by age 18 to prevent a gap in income supports. What's important is that most people are denied initially. And so you should be prepared for an appeal, and the appeal is very quick. You must do it within 10 days to make sure that you must do it within 60 days. But that 10-day period is to make sure you're still getting your support during the appeal. This is separate from applying for Medicaid. A lot of times you need this SSI determination to be able to apply for adult Medicaid. So it's really important that you're thinking about that at age 18 before aging out of Medicaid at age 19. One other thing to consider in terms of healthcare transition is whether you need help making decisions. And this could be because you just want someone there to support you and to make sure that there is like a second in line. It can also be because you have a condition that makes you at risk for not thinking clearly when you're sick. And you need to designate someone to make those decisions for you when you're unable to make decisions on your own. The highest level of decision-making support is guardianship. This is a legal relationship where you have to go in front of a judge. You get a physician report, you get an attorney, and the judge appoints a guardian in court. And that guardian is really able to make all decisions, healthcare and financial, for the person that is under his guardianship. We're not really seeing this happen too often. We're seeing that guardianship is really not taking away a lot of power from a young adult. And it's a little stronger than it needs to be for what most people with metabolic disorders need. Instead, we have people putting in place power of attorney. There are two separate types of power of attorney. First is a healthcare power of attorney, which is when you designate someone to make medical decisions on your behalf. The second one is a financial power of attorney, where you designate someone to make financial decisions on your behalf. It's important to put this in place around age 18, especially if you're a parent who's worried about your kid in long term, because parents are not automatically first in line for decision making. When a person gets married, their spouse becomes first in line for decision making. And so this can be a problem if you are a parent to someone who's maybe you're concerned about a relationship they're in. And so you may want to have some of these decision-making supports in place to make sure that you don't lose that power for making decisions because you're worried about your kid. One of the other really important parts of transition is education and vocational rehab. So making sure that educational supports are in place before people turn age 18. The IDEAS Act, the Individuals with Disabilities Education Act, was passed in the 90s and then updated in the 2004 to ensure that all children with disabilities have available to them a free, appropriate public education that emphasizes special education and related services designed to meet their unique needs and prepare them for further education, employment, and independent living. The IDEAS Act is underneath the Department of Education. And so it is a worry that if the Department of Education is dismantled, what will happen to the IDEAS Act? And I don't think that's something that we know the answer for right now. But really one of the reasons why the Department of Education is so important to our community. What the IDEAS Act means, before age 18 is IEPs. So an individual education plan is an agreement between parents and the school about what services each individual student is going to need. This is something that you probably had throughout your childhood, throughout your schooling, and it gets renewed every year. And really, the IEP committee at each school should be looking at how the year has gone and what they would want from each student the year. Because individuals who have disabilities or have reasons to stay in public schooling, they are eligible to stay there until their 22nd birthday. And so the IEP will run through those extra years from age 18 to age 21, as long as you're talking to your school in advance and making sure that transition is going to happen. There are some schools that are not going to be very forthright about that 18 to 21 period because for budget reasons. And so it may be something that you need to push for if you're not getting it, easily from your IEP group. Usually, a written transition plan should be started around age 14 and a half, or between age 14 and a half and 16. 16 is the federal cutoff. And then transition services end either when an individual graduates or turns 22. And it's your birthday. It's not like the end of the school year. And so this is like kind of the cliff that everyone talks about, where all of these services that have been included through public education really end on that 22nd birthday. And it's really a struggle to find a lot of services after that. The transition services, these post 12th grade services, can be involved in both academic and functional achievements. And they really take into account the individual person's needs, strengths, and preferences. So some examples of transition services that you might see are post-secondary education, vocational education, and integrated deployment. So on-the-job training with a job aid, continuing in adult education, adult services, independent living education, and then community participation. And so these are available from age 18 to age 22. Because of that cutoff, because you're not technically graduating, there has been a law put in place that allows a student with a disability to participate in graduation, which is a big life event. I don't think it's fair to have a student who is preparing to stay in the school system not be allowed to participate in this rite of passage. And so these students can walk with their high school class, but they are not technically graduating. They are going to continue to read secondary transition services. So again, some school districts are really, really open and helpful about this. Some school districts are not. So knowing that there are laws to protect things like walking and graduation is important to know. There have been cases where families have been preparing for post 12th grade education for transition services and have been told, oh, your student walked in graduation and they're no longer eligible, so you need to figure out what to do. So knowing that this is a possibility is important. The prioritization of urgent needs for services is how we prepare kind of for that after age 21. And so this is something that you're able to sign up within adolescence and you get put on a list. And this list is long and you're not guaranteed services. It's not entitlement, and they really prioritize people based on the level of their disability. And so it's important to think about it early and then to kind of be on your team a lot to see where you are in the waiver list. Vocational rehab is one of the things that is offered with PUNS, which can really help individuals with a disability. So both in preparing and retaining and regaining employment that works for them and that they are supported through. The idea is that you're going to find the right job placement for yourself, for your child, and have the support that is necessary to continue them in their employment. The way that vocational rehab is determined is that you're going to meet with maybe a counselor from the OPWDD, from the DRSVR, and kind of talk through what services would be needed and how they could benefit. And then again, it's the same idea as the puns. The people with the most severe disabilities are going to get services first, and the people with lesser disabilities are further down on the wait list. So those are kind of the nuts and bolts of what the big parts of transition care that may not always be apparent, but really are life-changing if you have them in place. So medical self-management, income supports, decision-making support, and then deployment and vocational rehab are all things that kind of need to be thought about before turning age 18. Other things, there are other adulting concerns and things that we're going to talk about later with the panelists that include things like driving, an important rite of passage, but might not be right for everyone. Romantic relationships and other social relationships. I think we're starting to recognize the role of stress, emotional stress, really causing medical issues in adults with IMD. And then another topic we're going to discuss later is that as you become an adult, you really get to decide who and when you're going to disclose your diagnosis to. But that can impact relationships. It can impact how you're going higher education and how it can impact employment. And then one thing that most patients are starting to learn how to balance is how do we have new adult onset conditions alongside our childhood metabolic condition? So the take-home points for transition is that everyone needs transition planning. You may never change doctors. You may stay with your metabolic provider from the day, from the week you were born to your old age, but you still need transition planning. You still need to talk about, the skills needed for self-management and employment and living alone. And it's kind of these are topics that are more than self-management, and they must be tailored individually to each person. Not everyone is necessarily going to do secondary education. Not everyone's going to go on to employment, but these skills need to be tailored and thought of for everyone. I think one of the downfalls that we've seen in transition planning for metabolic disorders is that they tend to really focus on dietary management, and it's really so much more than that. So if the only thing that you're learning about for transition is how to get, measure your own and mix your own formula, there's more that needs to be taught. I think the really important take-home point, though, is that no one is ever fully independent. And when we look at people who have been most successful at transition, it has worked best when it's approached as a team. So when a young adult knows kind of what they're going to do independently, but where they go when they need help, who they can talk to. And so nobody should feel like we're teaching you these skills so you can go out on your own and do everything by yourself. That's not how life works. It's about knowing what you can do on your own and what you need help with. And that's really where the team approach is really beneficial. So I am excited that we have some adults who have been through this transition who can share their experience, and that this is our opportunity to really kind of discuss how that process was for our panelists, and how we can best help. I guess Jenna, Ben, Amber, Gabby, do you guys want to go around and introduce yourselves quickly?
I can start if you want.
Sure.
Um, Hi, I'm Amber. I have classic MSUD. I currently am holding 4 jobs, which is a lot for someone with MSUD. And I guess I could say my biggest supporter is my dad. He helped me through college, and I graduated at the top of my class with my master's.
Amazing. Ben, how about you?
Hey, I'm Ben. I'm a classical HCU patient. I am an elementary school PE teacher, and I live in Georgia. My biggest supporter is my wife.
Jenna?
Hi, I'm Jenna. I was born classic MSUD. I actually got a liver transplant in 2007 when I was a teenager. I currently live in Madison, Wisconsin with my husband and work as a mental health therapist.
And Gabby?
Hi, I'm Gabby. I'm 23 years old and I live in Massachusetts. I have classical homocystinuria, and I work full-time in marketing. And then in my after hours, I do marketing for HCU Network America. And my biggest supporter is probably my parents.
So we are going to just dive in and talk about how your experiences with transitioning to adulthood. So by asking, when did you first start taking more responsibility for your own care?
For me, it was when I started going to high school. My parents really tried to put more of the emphasis on me, making sure that I got my formula, that I started tracking my protein more so than always relying on them to do it. And by picking that up early high school, it really made it easy when I left the house and went to college, and I was better prepared to do that kind of stuff then.
I think for me, personally, I started kind of on the younger side. I was a patient of Dr. Ampola, so she always made it an open door policy to ask as many questions as I wanted as a patient. And she kind of treated every one of her patients like her kids. So I started like tracking my own protein probably when I was 10. My family, my dad, my mom always, was on top of my formula and explaining to me when I would be when I should be doing my formula, which for me would be morning, afternoon, and night. So it's spread out, and it became just an everyday thing because my mom was in the medical field. She would teach me things, and so did my dad. So I started very young.
I definitely also started very young in terms of protein and formula management. My parents were under the kind of rule that they would always guide us and be there for us and remind us to take our formula, but that at the end of the day, we needed to learn how to do this. In terms of doctor appointments, I've always kind of leaned on my parents in those. And up until probably about 4 months ago, they were coming to my appointments and they were helping me kind of digest the things that I was the conversations that I was having. But there definitely was a steep drop off at 18, I would say, in terms of having their involvement in things.
And Gabby, did your parents prepare you? Did your doctors prepare you for being more independent in appointments?
Um, I think my parents really prepared me around, I'd say like 13 or 14, my parents started stepping back in doctor's appointments and just being there as a sounding board, I'd say. Sometimes I tend to underplay the things that I'm feeling. So sometimes they pipe in and say, hey, no, like you're not feeling that way. You've been saying other things. So, but then at 18, that's when doctors fully started addressing me, and not really addressing my parents anymore. So there was definitely a very distinct curve at that point, but I was still advocating and speaking in appointments prior to that.
Right. I would say growing up, my parents took a lot of charge over telling me when to have my formula and everything. And I started taking more interest probably late middle school, early high school. And then when I got my transplant at 16, that was really kind of a launching board because it was new for everybody. Like it was new for my parents and for me. And so I really kind of took charge of that, because the entire time they were like, okay, you're very close to being an adult. You need to be able to do and manage on your own.
Jenna, what role did you play in the decision making around your transplant?
Oh, I was the one to choose my transplant. My mom didn't want it, but she told me I could make my own decision. It was presented as an option, in a couple of the MSUD symposiums that we had been attending, and I'd been struggling with managing my levels in protein intake despite everything, still struggling. And so I was like, transplant's got to be better than this. So let's do it. And I was like, okay, it's your life. We can sign up and get evaluated.
And I mean, it's really remarkable because that is like the first healthcare decision you made. Is that the first healthcare decision you
Yep.
made independently?
Yep. That was probably it, that I decided that I'd rather have a transplant than MSUD at that point. And I was like 15.
Yeah. I mean, that is not an easy decision to make. So it's really impressive. You guys have all started pretty early in learning about all these dietary self-management skills. What strategies did you use to help with that transition where you started to take on more of the responsibility yourselves? Or what strategies are you using now to make sure that you're taking all your formula right or taking your medications right?
I guess I'll go. Um, so I really heavily like for appointment management, I really like that my current medical system, they have an online like app. I'm sure many hospital systems do. And so from the app, I can see like the last step. I could see my own labs, and everything, and I can make my own appointments. And so that kind of helps me stay on top. But really, for the day to day of like taking meds and stuff, a lot of alarms because else I get busy and distracted. I don't know if anybody else struggles with that.
I definitely agree with the alarm thing. I have like 7 or 8 set a day. But in terms of formula and more diet management, I, in the past coming months, have kind of moved over towards the Flock app, which can be really helpful. And it's kind of a place where I can input the formula that I'm taking, the protein that I'm ingesting, but then also other things like mental health. So kind of a holistic app for a patient, which has been really nice.
I may need to try the alarm thing because it's always been a struggle for me to spread out my formula like I'm supposed to. That's the thing that the doctors at Emory always tell me you should be taking this 3 times a day, and it's always that's always been my biggest struggle in managing my formula. Um, so that might be something that I need to try. As far as like tracking my diet, I'm actually I track calories as well, and the app that I use for that also tracks the protein intake as well. So like I can look back, see what I've had through the day, and it kind of keeps me on track that way.
What's the name of that app, Ben?
It is called Healthy with an I. It's HEALTHI.
And is
It's like a
there,
Weight Watchers app.
okay,
That's
I was gonna say, is there a reason that you started using that one versus other apps? Um, Ben, I guess what has been your challenges in making sure you get your formulas
the biggest thing is I don't want to take it. It tastes disgusting.
Mhm.
The actual formula I've recently changed to taking HCU Easy Tabs as half of my formula, so that has made a world of difference. I'm hoping when I go back that the doctor will let me just go fully on the pills. because the liquid formula that I take, it doesn't matter the brand, the flavor, like it all tastes like garbage and it upsets my stomach. And it's always been like that. I'm 35 and I've never had a formula that had a pleasant taste.
Yeah, it's nice to
And
have.
can I oh, sorry.
No, go ahead.
Can I piggyback on the formula comment? Because I always call my formula the bog of the eternal stench. Because if you smell that, it will, like, the smell just super glues itself. But I can relate. Like, it's hard sometimes taking the formula when it smells and tastes the way it does. I've learned Nestle Quick sometimes can match the taste, but with some formulas, I'm sure that doesn't even come close to helping.
And Amber, have you tried anything like Easy Tabs or other options so that you don't have to take
And
formula?
no, I'm a weirdo when it comes to that, just because the fact that I get nervous at the idea of changing my formula because I've been through I when I was 7, I was given the wrong medicate I was given the wrong formula and I was hospitalized for a year. Um, I I had brain swelling and all that. I don't know how I didn't wind up with brain damage, but after that, I'm like the scaredest person when it comes to switching my formula or anything that has to do with that.
And so if it is the least favorite part of your day, how do you get yourself to do it?
I remember what it was like being 7 years old and going through that for a whole year, and I will do absolutely anything to never ever feel that way again or experience that. There is nothing more terrifying than a metabolic crisis where you're hallucinating and pardon the analogy, but it was like a bad acid trip at the age of 7 years old. And the PTSD that followed with that, that took me up until just recently to get past 90% of my phobias was wild. I don't care what I have to do to never experience that again.
One of the questions we have from the attendees is if you had one piece of advice that you could give to your parents about your early care, what would it be? So kind of about how you were how your parents treated your condition, treated your medical care when you were kids.
I think one of the most important things I will tell you, and this is coming from a child with two polar opposite parents when it came to dealing with emotions. I had a mom who was an EMT, so she was very compartmentalized when it came to any medical stuff because she technically never left work, if you will. And then I had a father who is very emotionally aware. So I want to say the biggest thing I learned as I got older is if you're scared, if you're worried, if you're having concerns, do not be always afraid to show those emotions because it helps us as the young patients to understand it's okay to have those emotions, and it helps us to understand, identify, and manage those emotions when we're going through them. And I think it's a great way to kind of help your child to understand they're not alone and how to work through those emotions when they're having them, because you got as a parent you're going to have secondary trauma from some of the things that we go through as your children, and we're going to have the primary trauma from it. So it's important to kind of be able to help your child identify those emotions and what those look like.
Amber, can I ask you a follow-up question based on that?
Yeah, go for it.
I mean, we're talking about kind of how you guys have learned about independence. It sounds like with very vigilant parents, was it hard for them to let go? And what did you experience when you were trying to be more independent?
I think, again, my parents were very different. Like, one was my mom was very forceful in sheltering me and putting me in a box, if you will, about MSUD and everything that I couldn't do versus concentrating on what I could do. While my father was more the encourager that would kind of gently push me out of the nest and let me explore, but also guide me and promote the independence and help me to understand the world through encouragement, while my mom was more fearful in the negativity from that because she didn't know how to deal with those emotions herself, made it really difficult. But my father helped me very much for my independence and being emotionally aware of what I was feeling and always telling me it's okay to feel those emotions. Let's talk about them. And that helped a lot with me becoming more independent.
Mhm. Any of our other panelists have thoughts on kind of what advice you would have given to your parents, and then how they handled you becoming more independent, or
I,
That, oh, sorry, go, Gabby.
oh, you can go. Okay. Um, I think, at least for me, I was really lucky to grow up with a set of parents that kind of checked all the right boxes in terms of what you would want from a parent or guardian with a child with HCU. I also was fortunate enough to have a brother who had it as well, who's 11 years older than me. So I definitely had a great nest of people that were there to support me throughout my life. I think the one advice that I'd give my parents is to take more time for themselves because, as Amber just said, it's hard on the parents too. And if you can't fill other people's cups if yours is empty. So I definitely think that I'd give them advice to kind of focus on self-care in terms of themselves.
Gabby almost took the words out of my mouth. My parents were very present and supportive, and so I think the advice I would give them is to be confident in the fact that they're doing a good job, and because I know that it really was a scary thing for them when I got my diagnosis because there wasn't a lot of readily available information, and just letting them know that them being present and them doing the best they can that was enough for me.
If I may piggyback on that too, what you just said, I think Ben, I think it's also important to kind of as parents to practice self-care as parents and to kind of model that for your children because when dealing with a chronic metabolic disease such as MSUD or HU, it takes a lot out of us too. So learning what practicing self-care looks like is super important as well.
How have you, as you've navigated adulthood, how have you talked about your metabolic disorder with friends or people that you're dating?
I can go. Um, so in terms of friends, I feel like my attitude towards it all has changed throughout my life. When I was younger, I wanted no one to know anything at all. I literally would drink my formula in the bathroom. Like I was not showing anyone what my life really looked like. But as I got older, something changed inside of me, and I found it was something that I wanted to embrace and not hide. I still do not bring my formula to work. I don't drink it in front of my coworkers. I always have a feeling that I want them to know me before they know my disease. So I still kind of have that part of me inside, but I am very open to anyone that wants to have the conversation and meeting new friends. You know, if they say they want to go out to lunch, I kind of have to say it. So I'm definitely more open about it now and trusting with people, but at the end of the day, I know that they can't fully comprehend what's happening, but they can at least be supportive and accommodating, which is very nice.
I
Or,
think that's great,
oh,
Gabby,
sorry, go
because
ahead.
I was gonna say I'm almost the opposite of that. I grew up like very small school. Everybody knew. Me and my younger brother also had MSUD, and so it was like very well known. We had to like take our formula. First grade, I actually did it in front of my class. Me and my teacher would race. She would eat her yogurt and I would have to drink my formula, which was always a fight at our house. Um, and so by the time I got to like high school, everybody knew about my transplant. By the time I got to college, I was like, nobody's gonna know anything. They're just gonna know me and my name, and that's it. Like, I'm not gonna tell people anything. And it's been nice to like kind of have that freedom to like I can let people know, but that's not like the first thing that they know about me. That's not my identifier anymore, it feels like.
I think for me, when I was younger, I really didn't have an option to kind of keep um, my MSUD to myself in any capacity. So people always knew me for my MSUD versus who I was, which is really tough. So it was kind of interesting when I got older and I had that control. Most of my friends that I surround myself with now are accepting and obviously very accommodating and supportive. My boyfriend goes above and beyond. If we go out, he looks at the menu before we even go out and make sure that I'm able to have something and not just fries. He's like, nope. He's like, we're not doing just fries. He makes sure that there's vegetables or something that I can try that's low protein, which I give him so much credit. Um, but I think it's sometimes hard too because even some adults will look at the diagnosis versus the actual person. And I've gotten made fun of because of the name of MSUD. And I'm like, yeah, no, I know. It's not a cool Latin name. No, it's not a cool German name or anything of the sort. It's something that, is kind of, you know, not I don't want to say embarrassing. Well, no, like as you get older, like you kind of wish it was a different name than Maple Syrup Urine Disease. But for the most part, if I dealt with bullies, I just kind of educated them and let them either accept it for what it is or leave it alone and just kind of embrace who I am because without MSUD, I probably wouldn't have the compassion, empathy, and strength that I do for myself and others. So
When I was younger, it was like my closest friends are the ones that really kind of knew the ins and outs of HCU. I guess other people knew that there was something different because I ate differently at birthday parties and things like that. And that was always, I talk about that a lot when I do interviews for my podcast about HCU, that like, that's what I remember the most when I stood out was at birthday parties and social events. But as I got older, I realized that nobody really cares about that. Like for me, anyways, like nobody's really looking at, everybody's so involved with themselves and worried about how they look that they're not really looking at what you're eating or how you look. Um, but my closest friends have always known, and they've always accommodated me when we go out to a ball game or to eat or whatever. And as far as dating, uh, HU never really played a role in that. Like, I'm no love guru, but if somebody is weirded out by your dietary needs, then they're probably not worth it anyways. Um, so I don't know. That's just me.
I think we have time for one more question. And so I just wanted to ask you all, like, what has been the best part about being an adult, and what has been the scariest part about being an adult?
In terms of like HCU and my diagnosis, the best part about being an adult is when I was younger, like my levels have always been under control. And so when I was a teenager and younger, my doctors at Emory always tried to get me involved in all the camps and all the things, and I was never interested in doing that. I don't know why. I was good. But now that I'm older and I've been around more people with the same diagnosis, and I see all the different ways that HU presents and all the different journeys. Like I enjoy being able to engage with the community try to provide some kind of support for families who are going through a very scary situation. Because, like I said before, that's a scary thing. Um, the worst part about being an adult in terms
Like,
of,
maybe not the worst part, but just like what worries you?
oh, okay. So, a lot of research kind of points to like, we've talked before about like Alzheimer's and memory deficits as you get older, possibly related to like methionine levels and things like that. So that is the scariest thing. I never want to forget, you know, the memories I've made with my family, with my kids. Like that's always at the forefront of my mind when we talk about the fears that I have for the future. So that's one reason why I try to stay so on track with the diet and the formulas because I want to mitigate those as much as possible. So
I can go. For the best thing, I would say definitely piggybacking off of what Ben said, I'm way more integrated into the community now than I was years ago because it didn't really exist a whole lot. So I definitely love being a face for what parents and young kids can look at of what adult life could look like with HCU. So I think that that is definitely the best part. And as I do more things and achieve more things, I am proud that parents can look to me for that. Um, for, I don't know what we're calling it, but the worst part of adulthood, I would say is as I get older, I have more other diagnoses that play into the role with HCU. So I think figuring that out has been really difficult. And just something that I've personally been navigating, which was something that I wasn't navigating when I was younger. So definitely new, and doctors are attempting to help navigate, but obviously with HCU, they might not know as much as they would if it was another condition.
I can go next. I guess the best part, at least for me, is learning to embrace my uniqueness with MSUD and like realizing that the how the experiences with MSUD shape me into a better adult in a lot of different ways in terms of how I perceive others that may have genetic diseases or other, other um, things that they experience, and being able to have the compassion that I do, I guess, kind of gives me a better view on just engaging with the other people and not feeling so alone. Um, as far as the downside of being having MSUD and being an adult, I guess the fear of what happens as I get older, like what as I go through life's milestones and changes in the body, how is that going to present? How is it going to present? Is it going to stay as, I don't want to say smooth, and I don't want to say good because I don't want to jinx myself, so I'll knock on wood, but is it going to be as manageable as it is? And I guess with my other alignments that are now presenting themselves, I guess it's just the fear of what's to come in terms of how is it going to continue to be manageable and what that's going to look like.
So for me, I would say one of the best things being an adult, probably the freedom. Since getting my transplant, like, yep, I have a lot of medical management, but I also get to like pick and choose what I want to do. And it's allowed me to pursue the kind of life that I wanted. Um, and so that's really cool because like in upper elementary, I remember like being worried that like I wouldn't be able to like go to college like my siblings did, or like what it would look like when I was growing up. Um, the worst part probably is, I'm gonna go with Amber that like there's always that unknown about the future. Um, being that I was like I was the first one to be caught by newborn screening with MSUD in 91. And then, in the first wave of MSUD to transplants, it's all kind of like I've just kind of figured like my entire life's a little bit guinea pig-ish. You're not really sure what's going to happen next. And so, you're just kind of going around thinking, things are good for now, right? But we never quite know what the longevity. I mean, they've never had an MSUD or MSUD transplant person in like their 70s or 80s. What does that look like? So I guess, yeah, just like kind of we're paving the way. Um, I'm so happy that like younger patients like have it easier because there's more knowledge rather than just kind of like the unknowns. And so yeah, so we'll just keep paving the way because what else do we do, guys?
And I would add, I think younger patients have it easier because they have you guys as role models. And it's really like, I really appreciate your candor and your openness tonight. And I hope that I'm sure you guys have helped people and that they know that they can reach out if they have more questions.
I want to thank everyone here. Oh, my camera just went in and out. I kept myself off camera. As our community knows, there's not a webinar that goes by that I don't have tears. So that's why I hide in the background. But it's been a completely inspiring evening. And we want to first extend our deep appreciation to Jessica Gold for her presentation and to our panelists for bravely sharing their experiences. We also want to make sure to thank our sponsors, Cambrook, Nexus, Nutricia, and VitaFlow for making this webinar possible. Tonight's session has been recorded and will be available to both the HCU and MSUD communities to revisit and share. And thank you to everyone for joining us and for being part of this collaboration. Together, our communities are stronger, and together we can create a brighter future for those living with rare metabolic conditions. Thank you for joining us this evening.